What if I told you that ignoring your penis could quietly lead to loss of function, painful health issues, or even cancer? And most men won't even realize it's happening until it's too late. I'm Dr. Anthony, a men's health expert with over 30 years of experience in urology. I've treated thousands of men in their 60s, 70s, and beyond. And I can tell you, most of the common mistakes men make with their sexual health are entirely preventable. You might think these changes are just part of aging, but they're not. In fact, there are 5 simple yet often overlooked habits that can protect your health, confidence, and sense of masculinity well into old age. In this episode, I'll guide you through the 5 essential steps every man over 60 should follow to maintain sexual health, plus a powerful bonus tip that could help you avoid one of the most damaging conditions men face as they age. And if you stick with me until the end, I'll reveal a nighttime habit that's often ignored, but could be the secret to preserving your erections while you sleep. Before we get started, make sure to subscribe and turn on the bell icon so you don't miss any future health insights tailored for men in their golden years. And if this content resonates with you, type 1 in the comments. If it doesn't, type 0. I truly value your feedback and aim to keep improving what I share. Let's begin with one of the most overlooked, but absolutely crucial foundations of male health in your later years. 1. Keep your penis active. Even if intimacy isn't regular, this one habit can help preserve your sexual function, confidence, and sense of vitality. As men age, a decline in sexual activity is often assumed to be normal. Hormone shifts and reduced libido are real, but the idea that sex or erections no longer matter is one of the most harmful myths about aging. Like your muscles or brain, your penis needs regular activity to stay healthy. Erections deliver oxygen-rich blood to nourish tissues and maintain nerve function. When erections stop altogether, the penile tissue can shrink, stiffen, or scar, a change that often goes unnoticed until it's too late. The good news? You don't need a partner to keep things healthy. Even solo activity, such as masturbation, remains a medically sound way to stimulate blood flow, support tissue health, and even boost mood through feel-good hormones. If achieving an erection is difficult, tools like vacuum erection pumps, used just a few times a week, can provide the necessary oxygenation and help preserve function. And remember, this isn't just about physical performance. Maintaining your sexual health is also about staying connected to your confidence, identity, and masculinity. I've had patients who thought they were too old to care, only to rediscover strength and joy when they reconnected with their bodies. It's not about performance, it's about presence. 2. Practice daily hygiene. Even if you're not sexually active, daily cleanliness is essential. Hygiene isn't just a concern for the young or sexually active. For older men, especially over 60, cleanliness becomes even more critical. As your immune system weakens with age, you become more vulnerable to infections, irritation, and even conditions like penile cancer. Studies show that poor penile hygiene is a major risk factor for this rare but serious disease, and rates are higher in regions with low hygiene awareness. Fortunately, prevention is simple. Gently wash daily with warm water and a mild, fragrance-free soap, ideally something pH neutral or glycerin-based. If you're uncircumcised, carefully retract the foreskin and clean underneath to remove buildup that can encourage bacteria or fungal growth. Dry thoroughly, especially in folds of skin, to avoid irritation. If mobility is an issue, try a handled sponge or ask your healthcare provider about assisted hygiene tools. And always wash after sexual activity, whether solo or with a partner, to remove fluids like sweat, semen, or lubricants, which can disrupt skin balance and lead to irritation or infection. Most importantly, hygiene is more than just a routine. It's a way of showing your body the respect it deserves, no matter your age. Cleanliness isn't about vanity, it's about vitality. 3. Avoid sex with a semi-erect penis. This mistake can lead to serious injury, even long-term damage. It's something many men don't think twice about, engaging in sex without a fully firm erection. Whether it's eagerness, pressure, or simply not knowing the risks, trying to penetrate when only partially erect can cause real harm. Erectile tissue is delicate. When it's not fully rigid, it bends too easily under pressure. Repeated bending or strain during sex in this state can cause tiny internal tears. Over time, these micro-injuries may lead to scar tissue, which can harden and form plaques, a condition known as Peyronie's disease. This can result in a curved or painful erection, difficulty with penetration, and a major hit to your confidence. Many cases require medical intervention or surgery. If you find yourself struggling to get fully hard, don't push through. Instead, take it as a signal. There are effective treatments, from medications to vacuum therapy, that can restore healthy erections even into your 70s or 80s. Bottom line, never settle for good enough when it comes to your erections. Listen to your body, be patient, and seek support when needed. Preserving function now means preserving your freedom and intimacy in the future. 4. Limit pornography. Reconnect with real desire. 4. Limit porn. Reconnect with real desire. In today's digital world, adult content is more accessible than ever, and for many older men, especially those feeling isolated or distanced from intimacy, porn can seem like a harmless escape. But what most don't realize is that regular, long-term use of pornography, especially when it becomes your main source of arousal, can gradually dull your body's natural sexual response. Over time, this can make real-life intimacy feel less satisfying, more difficult to initiate, and even harder to physically respond to. Your brain, much like your body, adapts to repetition. When it's conditioned to respond to fast, highly stimulating visuals, it begins to expect that same intensity to become aroused. The result? Genuine human connection, with its slower pace and imperfections, can start to feel flat or uninteresting. This is called desensitization, and it's something I see all too often in men over 60 who wonder why they've lost their spark, even though their physical health seems fine. There's also a psychological impact. Relying on porn for gratification can lead to guilt, emotional detachment, and in some cases, a sense of dependence. Some men even begin to doubt their ability to connect with a partner or fear they won't perform in a real-world setting. Breaking that cycle begins with self-awareness. You don't necessarily need to give up adult content altogether, unless that's your personal choice. But you do need to reflect honestly on how it's affecting your physical health, emotional state, and relationships. If you've noticed a drop in desire, weaker erections, or a growing disconnect from your sexuality, reducing or pausing your use of porn could be a major step forward. Many men are surprised at how quickly their natural sensitivity and interest return once they give their brain and body a reset. 5. Your lifestyle equals your performance. When men think of sexual health, they often turn to quick fixes, pills, supplements, devices. But after over 30 years in men's health, I can tell you this: the most powerful influence on your sexual performance isn't found in a bottle. It's found in your daily lifestyle. Everything from how you eat, move, sleep, and manage stress directly affects your body's ability to perform. That's because your penis is part of a larger vascular system. Erections depend on strong blood flow, balanced hormones, and sensitive nerve function, all of which are shaped by the choices you make every day. If you smoke, you're damaging blood vessels. If your diet is heavy in sugar or you carry extra weight, you're increasing your risk for diabetes and heart disease, both major causes of erectile dysfunction. Too much alcohol can dull sensitivity and throw off hormones. And chronic stress or poor sleep can drain testosterone and kill your desire. But here's the good news. Small changes go a long way. Start by walking 20 minutes daily. Drink more water. Eat whole foods. Think colorful veggies, lean proteins, and healthy fats. Cut back on sugar and alcohol. Prioritize good sleep. And if you smoke, quit. It's one of the most damaging habits for both your heart and your erections. It's never too late. I've seen men in their 70s and 80s restore their performance simply by taking better care of themselves, not to look young, but to feel alive and connected again. Sexual health isn't about perfection. It's about consistency and care. Bonus tip: sleep without tight underwear. This next tip might sound small, but it could be silently affecting your sexual health every night. Many men don't think twice about wearing tight briefs or snug pajamas to bed. But during sleep, especially during spontaneous nighttime erections, which are healthy and important, tight clothing can place pressure on the penis. That pressure, repeated night after night, can lead to micro-injuries in the tissue, something you likely won't feel at first. Over time, this can result in internal scarring known as fibrosis, which may develop into Peyronie's disease, a condition that causes painful curvature and difficulty with erections. The fix is simple. Sleep nude or wear loose-fitting underwear that allows your body to move freely without restriction. It may take some getting used to if you've always worn tight briefs, but many men find it more comfortable and even notice better sleep and improved circulation. This is one of those subtle changes that can make a big difference over time. It won't be advertised in commercials, but it's rooted in real health awareness and prevention. Final thoughts. A message every man needs to hear. If you're still with me, it tells me you care about your body, your independence, and your quality of life. And that alone sets you apart. Too many men are made to feel that sexual health is something they should quietly give up as they age, buried under silence, shame, or resignation. But I want you to know, that's simply not true. Caring for your penis is about more than sex. It's about preserving your confidence, dignity, and sense of self. We've covered staying sexually active to keep blood flow strong, practicing daily hygiene to prevent infection and disease, avoiding sex with a semi-erect penis to prevent internal damage, limiting porn to reconnect with real desire, and building a lifestyle that supports your health from the inside out. Plus, the bonus habit of sleeping without tight underwear, because even small, quiet behaviors can have a lasting impact. None of these steps require youth, wealth, or perfect health. What they require is a decision to care for yourself consistently and intentionally. These are more than tips. They're acts of self-respect. They signal to your body that you're still in the game, that you still matter, and that your best years can still be ahead of you. I've watched men in their 60s, 70s, and 80s reclaim their vitality, not by becoming someone new, but by returning to the best version of who they already are. So if anything in this message spoke to you, don't let it fade away. Take one small action today, then another tomorrow. That's how real, lasting health is built. And remember, it's never too late to take care of the man you've always been. If this video resonated with you, please share it with a friend, brother, or son who might need it. And don't forget to hit subscribe and turn on notifications. There's a lot more ahead, and we're just getting started.